So you might think about having a planned caesarean section for your delivery. Some women choose to have an elective caesarean section for a number of reasons. It can give an element of more control about what's going to happen because you know that you definitely will have a caesarean to deliver the baby. And for some people, knowing exactly when things are going to happen and how they're going to happen is a really important feature of decision making. One of the things that you can guarantee with a caesarean section is that it is an operation, and it's a reasonably major operation from a medical perspective. In the context of deciding on a planned caesarean when you've had a caesarean before, one of the things that we always think about is how straightforward is that operation going to be. There will be some scar tissue inside, and so the operation often takes a little bit longer than the first time that you have a caesarean section. And the doctors who do the operation will want to make sure that they're carefully moving other tissues inside out of the way of where the womb is before delivering the baby. So we do usually advise that the operation can take a little bit longer overall, and that there is a slightly higher risk of certain complications with the delivery, in particular things like damage to the bowel or the bladder, which are inside the abdomen above the womb. Obviously we take great care not to cause any damage like that, but we can't guarantee it, and so usually when people discuss a caesarean with you, they will talk about this particular risk and talk about what we would do if there was any particular problem with the operation. In every other respect, the caesarean is very similar to the first time that you have a caesarean section. We deliver the baby, deliver the placenta, and then get on with all the stitching up afterwards. There is a small risk of requiring a blood transfusion. There is a small risk of infection, so we usually give antibiotics to reduce the risk of that. And there is a small risk of problems with circulation that can lead to blood clots in the legs and the chest. And so we give some special injections and special stockings and get you up and about as quickly as possible to try and minimise the risk of those particular complications. The recovery afterwards is a little bit longer than with a straightforward normal vaginal delivery, in that you would expect to be in hospital for between 1 and 2 days after the surgery, and then when you go home it takes a good couple of weeks to be able to be up and about and lifting and carrying. And indeed we usually advise that you should only be lifting and carrying the baby and not doing any other heavy work or housework at home. It probably takes up to about 6 weeks to recover fully from the operation, and it's advised that you don't drive for 6 weeks afterwards as well. So if caesarean is what you decide upon, it's important to make sure that your home situation is going to allow you to be able to recover safely and comfortably in that respect. The other thing to consider in respect to caesarean section, if you have 2 caesareans, is what might you think about in the future in terms of more children. And if your intention is to try and have quite a large family, it's important to bear in mind that once you've had 2 caesarean sections, it's normally advised after that to actually have caesareans in the future, because the risk-benefit ratio is more in keeping with going for a planned caesarean rather than trying to go through labour. One of the things that we can't predict is where the placenta attaches itself inside the womb if there is another pregnancy, and when you've had an operation on the womb, the placenta can sometimes attach itself to the scar on the inside of the womb, and that's a condition that we call placenta previa or placenta accreta, which is when the placenta is low down in the womb and it's actually stuck to or going through the scar from the caesarean section. And this is a potential complication that is quite rare but becomes more common the more number of caesareans that you have, and one that we can't predict or prevent necessarily. We can do scans during the pregnancy to identify where the placenta is. If we find that it is in a potentially dangerous position, we would normally recommend to do a caesarean section, but we would anticipate that there would be a higher risk of bleeding at the delivery, and there is a higher risk of not being able to easily remove the placenta. And for some women that can become quite complicated at the surgery, in that there's a need for major blood transfusion and other interventions, including hysterectomy in a very extreme situation. So deciding upon a caesarean for the second delivery, if you're thinking of maybe having quite a large family, and maybe that meaning that you might have 3, 4, 5 caesareans in the future, does have other implications in terms of safety for yours and your health. And if you were to decide upon a caesarean section this time, that's something that we would normally talk about with you in some detail in the clinic whilst you're making your decision.